working.
Welcome back, everyone. September is National Prostate Cancer Awareness Month, and today on WMBF News at 4, we want to make you aware of just how prevalent the disease is in our community and get you help. Joining me on the show now is Dr. Sue Tobin and Dr. Lawrence Holt from the Coastal Cancer Center. Thank you guys for your time.
Thank you.
Good. So I want to start with prevalence, first of all, because you say that this is the most prevalent cancer in men in South Carolina. Talk to me a little bit about some of the statistics.
Well, it is the most prevalent cancer that's diagnosed in South Carolina. The second most common cancer is lung cancer, and that's in men. Okay.
Deaths, more than 3,000 new cases yearly?
That's right. About 3,300 new cases were diagnosed in 2010.
Okay. And 484 people died in 2010.
That's right.
Unfortunately.
Do a lot of people die from this, or it can be prevented?
When caught early, it can be cured.
When caught early.
And that's the trick on all cancers.
Okay. And talk to me just about the risk. Who is at risk? I know it's older men, African-American men. Who else should be at risk, and who is at risk?
Well, actually, all men. If we live long enough, we all are run the very substantial risk of getting prostate cancer. But in particular, as you mentioned, African-American men, people who have a high fat in their diet, things of that nature.
But they're screening for it. I mean, we don't have to get to that point, correct?
Absolutely.
You can have screening for prostate cancer. Others that are at high risk are men that have a first-degree relative that's been diagnosed with prostate cancer, such as a brother, a son, a father.
Okay. And I know it's not an easy subject. You know, men don't like to go to the doctor, unfortunately, not all men. But what can we say to our loved ones out there to encourage them to go?
Well, certainly, just because you haven't gone to the doctor and had a PSA test done doesn't mean that you're clear of cancer. And it is important to be screened so that you do know, is there any sign of the cancer? But it's important to also look for some of the symptoms that might indicate a possible prostate cancer, early prostate cancer, for example.
And we're going to talk about some of those symptoms coming up in the second segment. I want to go over to the live web right now because we have a story online about someone who actually had prostate cancer, so folks can check that out. In the meantime, I thank you all for your time, and we're going to pick this back up in the second segment. Thank you, Dr.
Very good.
All right.
Thank you.
Well, it's another Friday.